Welcome back to the Bendy Nurse Podcast. Today is episode 5. So today I'm actually going to be talking about narcolepsy. And how does this... I've got my notes here, by the way. Oops, can't really see it. Thank you, AI background. So how does narcolepsy tie into the broader theme of the Bendy Nurse Podcast? Well, chronic invisible illness, kind of the ongoing theme. So we're going to talk about what it's like to to live with chronic invisible illness, how it shapes identity, relationships, education, work, self-trust, and why validation and understanding matter just as much as treatment. So personally, and I do want to add, hopefully today is one of the last episodes of me being like a solo podcaster for the full episode. I've got 2 lined up, one with a nurse anesthetist, talk about intubation and general anesthesia care and patients with hypermobility and just in general, and how a patient's, ongoing illness can affect the treatment decisions that they make, as well as a PA who runs the dysautonomia and POTS clinic in Columbia, South Carolina. So super excited about those. I hope you guys will tune in. So basically, narcolepsy. What the heck is narcolepsy? I think a lot of people, or at least I did before I actually knew what it was and knew I had it, thought narcolepsy was what you see depicted. Someone is just standing there and then all of a sudden they fall asleep, or the dog running in the field and then he flops down in the grass and he falls asleep. Narcoleptic dog. I think narcolepsy is assumed, oh my God, so you just randomly fall asleep? No, narcolepsy is on a spectrum, just like autism. There's a spectrum. Cataplexy is really what's on the spectrum with narcolepsy. So you have status cataplecticus, which is all the way on one end, and then you have just baseline general cataplexy on the other end. I definitely do not ever have status cataplecticus. Sounds like status epilepticus, which is, when you're having a full-blown seizure, not responding to meds, anything like that. If you have extreme cataplexy, you may fall on the ground, lose all muscle tone. You're fully aware of what's going on, but your body has jumped into REM sleep. Like your brain, you're still awake, but your brain thinks you're in REM sleep. And normally when a body goes into REM sleep, you have muscle paralysis. I believe it's called muscle atonia. And that is a protective reflex for the body so that you don't harm yourself, which I'm going to do a whole other episode on this probably. There's this thing called REM, sleep behavior disorder. It is a comorbid condition with narcolepsy. You basically you keep your muscle function during REM sleep, which is bad because you can then act out your dreams. You can harm yourself. You can harm others. This is something that I've suffered from the entire time I've had narcolepsy, which my narcolepsy actually dates back to age 5, I'd say, is when my excessive daytime sleepiness started. Just a lot of sleep disturbance and stuff like that. So, and another thing about narcolepsy, cataplexy, some people have it so bad that they will fall on the ground because they're in status cataplecticus. And then other people, and I will say cataplexy is usually triggered by emotions. So happy, sad, being startled. Mine is usually laughing and being startled, mostly laughter. For example, the other day I was giving Grayson a bath and he was standing up in the tub. It's not really safe to be 2 years old standing up in the tub and jump, jump, jump. Well, he wanted to stand up in the tub, the slippery tub, and start jumping and singing to it. And I thought it was so funny. And so I'm trying to hold on to him while I'm laughing. And then I start losing my grip on him. And I'm like, Eric, I need help. I can't hold on to Grayson. So anyways, or a couple months ago, last year, my friend and I were walking into the store. I was holding Grayson. She made a really funny comment and I started kind of losing my grip on him. So thankfully I've never dropped him. But I lose strength in my hands and sometimes in my face. I'll never look like I'm having a stroke, but I might get a little bit droopy and just, I can't smile. If you ever are tickling me, not that would happen, but if you're ever tickling me or making me laugh really hard, I'm please freaking stop, stop, because I am actually losing muscle strength legit. And becoming partially paralyzed, and it's terrifying. Whatever you're saying is probably hilarious, probably worth the laugh, but not very fun to experience temporarily. Narcolepsy is often misunderstood because its most disabling symptoms are quote unquote largely invisible and can be dismissed as laziness, lack of motivation, or anxiety. I read earlier, the hallmark features: cataplexy, excessive daytime sleepiness is present in 100% of people with narcolepsy. Then we've got hallucinations. You've got hypnagogic and hypnopompic hallucinations. Those occur when you're falling asleep and waking up. I will also talk more about that because I experienced both. My falling asleep hallucinations are seeing spiders running up the wall. And then my waking up hallucinations are seeing writing on the ceiling. So then you've also got sleep paralysis. And then what else do we have? I know I'm missing something, but anyways, all right, me. I was officially diagnosed with narcolepsy with cataplexy in 2018. The reason I saw a sleep specialist is because I was seeing a doctor for night terrors, and he had prescribed prazosin, which is a medication for prostate enlargement. Sorry, if you see me, I'm looking at the baby monitor because Grayson's napping and he may be waking up soon. So anyways, prescribed prazosin. I actually passed out on that. Night terrors weren't getting better. And so he was like, you know what, like, I'm going to refer you to a sleep specialist. So I go and I'm like, yeah, I think I have this thing called REM sleep behavior disorder. And we're like talking about my symptoms. And I'm like, yeah, I can fall asleep anywhere, anytime. Like, yeah, that's my whole life. I've always slept nonstop. In fact, I was actually late to my appointment that day because I had such a hard time waking up. Anyways, she was like, I think you might have narcolepsy. I was like, what? I had my sleep study done, and my sleep onset latency period was 3 minutes. So that is the time between closing your eyes and falling asleep. I believe average is 7 to 15 minutes, maybe. And that's for people who don't have insomnia. Usually with narcolepsy, you're going to have sleep onset REM. So as soon as you fall asleep, you're usually within about 30 minutes, you're going to enter I hate this background because it completely blurs me out. You're going to go into REM sleep. So you're going to start dreaming. That is diagnostic of narcolepsy. I did not, of course, a freaking course. I was on clomipramine. Clomipramine is a treatment for OCD. It is a tricyclic antidepressant, and it is also used off-label. Actually, not off-label. It is approved for the treatment of cataplexy. It also suppresses REM sleep. So if you think back to what I was talking about, when people go and have cataplexy, they're losing that muscle function and all of that. Their brain thinks they're in REM sleep, which is that protective reflex. If clomipramine is suppressing REM sleep, therefore helping with cataplexy, it's not going to show up on a sleep study. But I have cataplexy. And cataplexy is almost always supportive of a diagnosis of narcolepsy. There are a couple times where you can have cataplexy and not have narcolepsy, but overall, almost every single case of cataplexy is going to be related to narcolepsy. And so, anyways, yeah. So that was fascinating. The sleep study, I did sleep. I had to do the nighttime one, which assesses for sleep apnea, other things like that. I don't have sleep apnea. And then I had to do the daytime one, the multiple sleep latency test. So that's the MSLT, which is the daytime portion. And you have to do 3 to 5 naps. I can't remember. And then it is so hard. And then you take a nap, and then they wake you up and they're like, did you dream? And I'm like, oh my gosh, I think so. I don't know. Then they make you stay up. So then I'm like trying to read, and then I'm having a hard time reading because I'm so tired. This was in college, in the middle of nursing school, and I was not having the best time of my life. So that was hard. Anyways, I went back a couple weeks later. He was like, yeah, so you have narcolepsy. The standard treatment is, let's start with stimulants. And I was like, I've been on stimulants my whole life. Well, sorry, my whole life is an exaggeration. Let's see, I started on stimulants when I was 12. At this point, I was 23. So I was like, for over 10 years, I've been on stimulants. And here I am, excessive daytime sleepiness. I don't know if they're super effective. He was like, good point. So we tried modafinil. And then he was like, let's start Xyrem. And I was like, cool. Because Xyrem is a medication you take at night and it improves your sleep and decreases daytime sleepiness. And it helps minimize cataplexy. So a great overall treatment for narcolepsy, so they say. I will never take Xyrem again. Last time taking it was in 2022. I will credit it with helping me graduate nursing school because I was on the brink of not being able to complete because of difficulties getting to clinical and just a lot of stuff overall. Starting that medication actually helped me wake up and get to class, get to my clinicals, graduate, be successful. All of that. I don't know why I said successful, but I guess you could say graduating from nursing school was success. Let me have some tea. So Xyrem is GHB, quote unquote, the date rape drug. It is a very, very powerful drug. Go on Reddit, look at the narcolepsy subreddit, and look at the people's posts on there. I don't think many people actually take this medication responsibly. The difficult thing about it is you cannot eat for at least 2 hours prior to your dose, and you have to take a dose twice at night. Now, there is a extended release one now, so it's only one dose called Lumerize. But I have gastroparesis issues, and it takes me about 6 hours to get an empty stomach versus what someone may have 2 hours. So I'd be working, I'd come home, I would have to eat my meal for dinner at like 3 p.m. So, and that's hard. You can't go to bed with an empty stomach. So I would take the medication, I would go to bed, and then actually I wouldn't go to bed. I would purposefully stay up until the medication took effect, and then I would eat my dinner. It is so dangerous. I never drove on it. I never burned the house down, never did anything like that, but very possible. You should go read the subreddit about Xyrem. And I'll leave it at that. So anyways, what else? My symptoms were most severe during high school and college. College was absolutely a terrible time for my narcolepsy. I have to take naps every day. I am prescribed naps. Sounds very strange, but I am. And I haven't been treated for my narcolepsy symptoms since 6-7 months now. I'm actually doing better. One of the nurse practitioner that I used to see, she, at the office that I still go to, but she's no longer there. She told me most of her patients actually had almost complete symptom relief during pregnancy. And she had one patient who would purposefully get pregnant to get rid of her narcolepsy symptoms because it made them that much better. Anyways, so I definitely still have my narcolepsy, still present. But overall, I mean, I'm not medicated at all anymore. And I'm surviving. I mean, I take a 2-hour nap every day. Now, there's an issue with that too, because then it goes into you sleep too long, you might have trouble sleeping at night. And it's funny because a lot of people with narcolepsy actually have insomnia. Strange, but it's true. I usually, for the most part, don't have insomnia. I've had some issues over the past couple months where I've had weeks at a time of not being able to sleep, and it impacts your entire life. A lot of that's probably pain related, but anyways. So let's see. All right, narcolepsy is an invisible illness. Let's talk about that. So narcolepsy doesn't usually, quote, look like an illness from the outside. This invisibility often leads to being labeled as lazy, unmotivated, unreliable. You can have internalized shame and self-doubt. Delayed diagnosis. That is a huge thing. So especially in children. First of all, I want to add, excessive daytime sleepiness is not routinely screened for. I worked in a pediatric office for 5 years. I worked in the adult population. The Epworth Sleepiness Scale and other screening measures like that are never used unless you're like, oh my gosh, like I have so many problems. And then they're going to refer you to a sleep study, and then you might see a sleep specialist, and then you're going to get the screening tool. A lot of kids with narcolepsy actually are misdiagnosed with ADHD. Now, you can have both. Of course, I'm not saying you like if you have narcolepsy, but you were diagnosed with ADHD, the ADHD diagnosis is not correct. That's not what I'm saying. A lot of kids, because staring off into space, it's actually sleepiness. Stuff like that can be mislabeled, and so that prolongs the time to diagnosis. Interestingly enough, Xyrem is approved for treatment in the pediatric population. We can be pressured to push through symptoms at the expense of health. I don't really know what I think about that statement when I looked up narcolepsy as an invisible illness, because I think there are a couple other things, such as being like neurodivergent, that can lead to more of that. I mean, not everyone with narcolepsy is neurodivergent. Burnout is the thing. All right. What is cataplexy? We talked about that. Cataplexy can be misunderstood as anxiety, clumsiness, or emotional overreaction. And that's funny because the emotional overreaction, so like if someone makes me laugh really hard, I'm like, and like my mouth is gonna, I looked ridiculous doing that. My mouth is like gonna be open and I'm just like kind of falling forward. That is not me overreacting. I'm very dramatic, but that is not necessarily me overreacting. That might be some loss of muscle function. Classic symptoms of narcolepsy, we talked about EDS, sleep attacks, unrefreshing naps. Now, interestingly enough, a 10-minute nap is almost the equivalent of taking a rescue dose of a stimulant medication. Cataplexy, sleep paralysis, hypnagogic and hypnopompic hallucinations. I didn't realize until a couple years ago that I was experiencing that. It's terrifying. It is terrifying. Automatic behaviors, driving and ending up at your final destination being like, whoa, where did the last 30 minutes of my life go? Cognitive fog, memory difficulties, attention challenges. Now, many of these symptoms are invisible to others, but can profoundly impact daily functioning. So, the diagnostic journey and why it's often missed. Clinical history and symptom patterns over time are important. And overnight polysomnography, which again, a PSG is the gold standard for diagnosing sleep apnea, other sleep disorders. When you pair the PSG with the MSLT, the multiple sleep latency test, that is the diagnostic criteria for narcolepsy. What about the role of advocacy and persistence in getting answers? Okay, you know what? I gotta say, I didn't realize that my excessive daytime sleepiness was actually not normal. I just was like, like it wasn't until now this, like I said, the Xyrem tremendously helped my excessive daytime sleepiness. And I think, excuse me, I think their slogan or whatever was, now I know what it feels like to be awake. Or finally I'm awake, something like that. Yeah, that makes total sense because it truly, kind of pun intended, was night and day. I was like, this is what other people like experience. Like they're not always like, this is what I feel like internally. Just again, I'm very dramatic. Don't think twice about my reenactment of my internal experience. So like feeling very heavy and just tired and like constantly, like you could actually fall. So when it says how dismissal mislabeling can delay diagnosis for years, I experienced this more with my EDS diagnosis and having to be my own self-advocate than I did for narcolepsy. The narcolepsy was a total surprise. And again, I didn't realize that what I was experiencing was not normal. All right. Treatment is a form of navigation, not cure. Thanks, ChatGPT, for that label. That doesn't make sense. For cataplexy and REM suppression, clomipramine, Xyrem, also for that. That is what is FDA approved for. Modafinil, armodafinil, Adderall, Concerta, Evicia, Ritalin. Those are medication treatments. For everyone is different. Sunosi is another. Wakix is another. And I do want to add that they are in the final stages of the clinical trials for the orexin receptor agonist. Is that correct? Anyways, my doctor explained it to me like this. Type 1 diabetes requires insulin to be treated. Orexin is insulin for narcoleptics. So what happens in your body is narcolepsy is somewhat of like an autoimmune type issue because, like, let's take the flu vaccine. I get my flu vaccine every year. I do not want you to think that this impacted my decision to not get a flu vaccine or something like that. The swine flu vaccine was at 2011 in Europe, led to a significant amount of narcolepsy cases. It is proven that it caused narcolepsy in these patients. What happened is their body attacked the orexin like receptors or whatever. Their body no longer produces orexin. Orexin regulates REM sleep and sleepiness. And so it is you might need to triple check me, but it is a histamine. So it is histamine. Think of antihistamine, Zyrtec, Claritin, Allegra. All of that is kind of in a sense the opposite. Like the older antihistamines such as Benadryl makes you sleepy. Orexin kind of, anyways, I don't want to confuse you because I'm not saying it's a stimulant effect or anything like that, but when some old school doctors, and it is not routine to get a spinal tap, but you used to get a spinal tap as part of the diagnosis of narcolepsy because CSF with low levels of orexin indicated that you have narcolepsy, especially in the presence of clinical symptoms. So I am so glad I did not have to get a spinal tap. So you can tell I have ADHD because of the random tangents that I go on, so I'm sorry about that. What else? We talked about treatment. Yeah, what works for one person may not work for another. What works for you one day may not work for you the next. So it is, I don't know. This is the first time that I've ever not been treated for narcolepsy, and I feel like I'm fine. The reason I'm not taking the treatment anymore is because I felt like my anxiety was so severe, and I figured, oh, maybe the stimulant's causing this. It hasn't changed. There are a lot of days where I feel that I would benefit from being back on a stimulant, but especially if Eric and I are thinking about, having another baby and stuff like that, I'd prefer to just leave it out of my system and get back on it after the fact. I was on a stimulant during my pregnancy with Grayson. I had a lot of preconception like appointments with doctors to talk about my options, make an informed decision. And I don't regret that decision. The only thing I regret about it is that if Eric and I do have a second baby, I am going to go into that pregnancy with a toddler and not being medicated for my narcolepsy. And I wish I kind of had a baseline from the first pregnancy to say how I truly felt off medication. So if I had any regrets, that's it. Grayson's fine. His health is fine. I actually participated in some national registries and stuff like that and did some mother to baby studies just because I feel like it's important for, medicine, and the study and treatment, safe treatment of moms, because a healthy mom is a healthy baby. So, that's really important to me, especially as a nurse. So let's see. All right, this is ChatGPT. Okay. Symptoms change. Identity can too. Narcolepsy, like many chronic illnesses, can evolve. Improvement doesn't erase the diagnosis. That is true. And I want to say improvement doesn't erase the diagnosis. It's true for everything because a chronic illness can have flares. It can have good days. It can have bad days. Someone with MS one day may need a wheelchair, may need a cane, may be bedbound, and the next day they're fine. That's why they have handicap placards. Some woman said, some days I need to use it, other days I don't. Just because I'm getting out of a car looking like an able-bodied person in a handicap spot doesn't mean that I don't deserve to have that spot just as much as anyone else who needs it. Again, improvement or looking better does not erase the diagnosis, and also doesn't mean that you've been cured. Chronic illness can still shape decision-making, boundaries, and self-awareness. So who was this episode for? People living with narcolepsy or suspected sleep disorders. Very vast community. I have a good friend who has a narcolepsy diagnosis. We're in a group chat with another friend, and the other friend who is not diagnosed was like, oh yeah, I was rock climbing and my cataplexy was so bad. And I was like, hold the front door. You have cataplexy? And she was like, yeah. And I was like, so do you have narcolepsy? She was like, oh, no, no, no. And then I'm like, you might want to look into that. And then lo and behold, she messages someone. That person is like, I need to see a sleep study. And then she does some research. She's like, oh, wow, like I might have narcolepsy. And then she goes see a sleep specialist. Now, that sleep specialist did recommend a spinal tap and whatnot. And there was just a lot going on in her life right then and there that was just doing a diagnosis was not ideal at the moment because you have to be off medications and stuff for a sleep test and all of that. So anyways, it was funny because 3 out of the 4 of us in the group message, well, 2 out of 4 for sure have a narcolepsy diagnosis. 3 out of the 4, well, I don't know how to say that. Another of the 4 had a probable narcolepsy diagnosis. Well, I mean, what are the odds? Because the odds of having narcolepsy are actually pretty slim. Let me look up the statistics. Odds of having I should look up the prevalence, but all right. Chances of having narcolepsy are relatively low, about 1 in 2,000 people in the US and Europe, though it's often underdiagnosed, meaning the actual rate might be higher. Genetics can play a role with a 1 to 2% chance of relatives of someone with type 1 narcolepsy, and specific gene markers such as HLA, DBQ1, 0602 are common in those with cataplexy. Risk factors. Risk factors include viral infections, brain injuries, hormonal shifts, with typical onset between ages 10 to 20 or mid-30s. So there are about 200,000 Americans living with narcolepsy. It's pretty wild. Narcolepsy is a rare condition affecting 37.7 out of 100,000 individuals. The incidence per year, 2.6 per 100,000 individuals. So while it's currently listed as a rare diagnosis, it's very underdiagnosed. So I'm very happy with the fact that I had a provider who was like, you know what? Maybe you should get checked out for this. So, let me go back to who is this episode for. Anyone navigating a chronic invisible illness, parents of children with unexplained fatigue. Now that's a scary one because as a mom and a nurse, if my child has unexplained fatigue, like my brain jumps straight to cancer or like anemia or something like that. I don't think unexplained fatigue would trigger me to think narcolepsy in Grayson. I mean, especially at his age. Now, as kids get older, you know, that could be a thing. So, what about loved ones wanting to understand why tired just isn't tired? Okay, that says a lot because people just like Ehlers-Danlos, just like other chronic invisible illness, chronic pain, you name it, you can't see it, you can't feel it. You don't know until you experience it. One time I saw that narcolepsy is like waking up fresh in the morning. Having narcolepsy versus a normal person. If I did not have narcolepsy and I was normal, but I stayed up for 72 hours straight, you know how tired you would feel from that? That is what narcolepsy feels like on the reg. No matter how much sleep you got at night, no matter how many naps, all of that. That is how significant narcolepsy is. I probably should have said that at the beginning as like a catch, like, hey, don't miss this episode. It's pretty intense. So think about that. Yeah, I take a 2-hour nap every day. Yeah, I try to go to bed at a decent time. But you know what? My body, I've done a full day of life, and my body still isn't functioning like it should. I am really powering through. And on top of everything else, like, I should call myself a badass. No, I'm just kidding. But really, like, it's not for the weak. So, anyways, final thoughts. Narcolepsy is a powerful example of how chronic illness can be invisible yet life-altering. Just remember that. Invisible illness can be life-altering. This episode reflects the heart of this podcast, validating lived experience, challenging misconceptions, and making space for stories that don't always show on the surface. So, anyways, I know this is not related to the zebra. It's not related to EDS, but it is part of my health journey. And it has definitely taken a seat on the back burner for the past couple years, which, you know what, I'm okay with that because it is not the most fun thing ever. It'll be interesting to and also we do think that I do think my mom has narcolepsy. She has had a lot of the same sleep issues as me, excessive daytime sleepiness. Again, my mom is not someone who really goes to the doctor. And she hasn't had a sleep study. And my mom just pushes through everything, which I wish I could be like that. I wish I could be like, oh, I'm fine. I'm just going to keep going, and not really think twice about it. That is amazing. Does she have the same experience as me? I don't know. We'll never know. I can't be in her body and she can't be in mine. We can only do the best that we can do. So again, I don't think my career as a nurse really helped my outlook on health because I go to the doctor if I need to go to the doctor. So anyways, like I said, the next 2 episodes will hopefully have some amazing guests. And it's been a couple weeks since I posted. Obviously, there was Christmas. There's a lot going on. But if you made it this far, thanks for joining. I know I embarrassed myself a lot on this episode. That's what I'm here for. I'm a very embarrassing person. I hope I didn't reveal too many embarrassing things about myself. Please don't take screenshots of the goofy faces that I was making. Anyways, I will see you next time. Have a great day.